Welcome back to the Posture Academy. I wanted to take a little bit of time and respond to one of the questions. Actually, it was a series of questions that one of our viewers, or whoever you want to call yourself, actually asked on one of my posts on TikTok. And so I wanted to go through each of these points and kind of talk about them because I think they're legit questions, and I think that there was a spirit of curiosity that came with this question. So I'm going to put it up on the screen. This is what the commenter asked, and I'll go through each of these ones, but it says, explain how a chiropractor fixes loose or unstable ligaments. Well, let's start with how to determine the ligaments are indeed loose and the mechanism and pathophysiology of that process. Oh, and which ligaments? All cervical? Certain ones? Does this process occur with the remaining ligaments in the body? Those are great questions. So let's break down each one of these questions. Let's go to the first one. How does, or explain how a chiropractor fixes loose or unstable ligaments? The reality is that a chiropractor does not fix by the definition of what this person or organization is asking. How does a chiropractor fix a loose ligament? Well, the truth is the ligament is probably not ever going to be fixed. I've said this many times over. A ligament, once it is damaged, is a permanent injury. I don't want people to think that the program or anything that we talk about is something that is going to cure your injury or your ligament instability. That's not what it is. Now, to go deeper into this, how does a chiropractor fix? Well, we don't. How do we stabilize? That's the better question. How do we stabilize a loose ligament? And that's exactly what chiropractors do. So let's dig into the nerdery of this whole process. When an adjustment happens, we have to understand that we are, in essence, strengthening the muscles. Now, how does a chiropractic adjustment actually stabilize or strengthen a muscle? Well, if you go to the gym and you create a resistance against that muscle builds, it becomes stronger. There are certain muscles that are within the spine. We have the rotors and we have the multifidus muscles. These muscles are the small ones. These muscles are the ones that attach from each segment to another segment. Their whole purpose is to create stability and mobility within the spine. Now, this is where we have to kind of think outside the box a little bit. So just kind of bear with me on this one. When we move that bone, however a chiropractor does this, it actually causes one of those two muscles, and almost every single time, both of those muscles to get stretched out. Inside those muscles, you have this thing called a stretch receptor, or a Golgi tendon apparatus. Every muscle in your body has a Golgi tendon apparatus. And that Golgi tendon apparatus serves one purpose, and that one purpose is to identify if that muscle gets stretched. And when it stretches, then it creates contraction. And that contraction is what creates stability within that muscle. So when we think about the actual adjustments, however it might be, now in my practice, we use a technique called the activator methods. It is a very gentle, instrument-driven adjustment. Every time that we adjust that segment or that joint, we create a stretching of that muscle. And that muscle then contracts. And the more times that you get this adjusted, the more times those muscles will actually become stronger. Now, this is where we can get into the argument of, well, can you get over-adjusted? We're not going to dig into that one too much because the answer to that one is, well, it depends. And then it also depends on the type of adjustments that you get done. I have seen so many adjustment styles that are being broadcasted and glorified on TikTok where you get the ring dinger and where they wrap the towel around your neck and you yank on and everything pops and everybody is happy. In my opinion, that is incredibly dangerous. That is a lawsuit waiting to happen. But that's a completely different topic. What I'm talking about specifically is the process of how a chiropractic adjustment actually creates stability within a loose ligament. And so when this person is asking this question, a chiropractor doesn't fix a loose ligament. A chiropractor helps to create stability within the muscles that are very specific to the spinal region. The next question is, how do we determine if the ligaments are indeed loose, and the mechanism and pathophysiology of that process? And this is another wonderful question. And this is one of the areas where I am actually a specialist because I focus on car crashes within my practice. We deal with a lot of ligament instability that happens because of the mechanism, as this person has pointed out. When we start getting into the change of velocity, also known as the jerk factor or the delta V, we can get into the math behind it. But I think that we don't need to dig that deep. We have to understand that if you want to have the occupant of a car, go from 0 to 60, and it takes you 30 seconds to do that, you probably are not going to feel much of a change within that velocity. But if you make that a split second, in fact, it's, if I remember correctly, it is 0.250 seconds to create an injury within a ligament. That can only happen with a sharp, abrupt change of velocity, also known as a car crash, a fall, getting punched. It doesn't matter. If you have that change of velocity within a very, very short period of time, then the ligaments are at risk. So how do we determine it? Well, in my office, what we do is we take what's known as flexion-extension films. These are known as the excessive motion ligament or x-rays, excessive motion x-rays, where we are identifying whether or not there is too much movement. So we can dig into those. So if we look at the AMA, or the American Medical Association, they have established a threshold. And that threshold is that, I'm going to use my hands here, that threshold is when you extend back, how much opening happens within that joint. Or if you flex forward, how much opening is in the back part of those joints. And we start talking about the individual uniqueness of the ligaments that are associated with that. The threshold that the AMA has established is that it's 11 degrees. Anything greater than 11 degrees of opening or splaying will cause a crossing of that threshold. Now, what we've determined is that there's subcategories within this threshold. We've determined that 11 to 14 degrees of opening is likely just a sprain, and those usually heal. They usually heal probably within 2 to 3, sometimes 4 weeks, depending on the severity of it. But if you go beyond 15 degrees, and actually the AMA has established that 15 degrees is the likelihood of a tear. And what we've determined within our clinical experience is anything between 15 and 17 degrees of that splaying or that opening up of those joints is where we get into what's known as a micro tear. This is where we identify as permanent injury. Anything 18 and beyond, we have macro tears, and those are definitely permanent injury. So when they ask the question, how do we determine that the ligaments are indeed loose, we actually use measurements, scientific measurements. There's lots of research behind this, but we use x-rays, we have motion. There are things that we can look at. Now then, one of the biggest questions and arguments that we really run into that comes from the insurance industry is that how do we know? We can put them in for an MRI. What does an MRI tell us? An MRI tells us if there's soft tissue damage. And usually it happens with things like we can see a blown disc or something that's herniated. And if we can see a herniation, then we know that there's definitely some damage. Here's the problem with MRIs. MRIs have false positives and they have false negatives. False negatives are going to primarily happen because the patient that's lying within that MRI unit tends to have no change within the movement of their neck. They are static. There's no movement within that. And if there's no movement within the ligaments or within the neck, then you're not necessarily going to see too much excessive opening or closing within those ligaments. And so we get false positives and we get false negatives. And more times than not, we get false negatives because we can't see, because the body is not weight-bearing. The body is not an emotion and a movement. We're not able to determine that because we are not in a position where we can do that. Now, they have things like functional MRIs, but functional MRIs are looking for different things. They have open MRIs, but open MRIs are not very detailed. So an MRI is actually not a very good standard of what we can determine as ligament damaged. So that brings us to the next question. Well, if we have static flexion and extension films, is there anything that's better than that? And the answer is yes. And I can put in here the research that was done that proved that what's known as a digital motion x-ray actually shows and proves on a greater standard that there is indeed ligament instability, because this is an x-ray that is taking place at the time that somebody is moving, putting their body into this motion. And so we can determine through digital motion x-ray that there is indeed ligament instability. Here's the downside with digital x-rays, digital motion x-rays. They are expensive for the provider to buy, and so therefore there are very few of them. And they are expensive to have done. So if you're really truly trying to find out the answer, do you have this? If you want a definitive answer, then you can look at what's known as the DMX, or digital motion x-ray. I was speaking with a DAC bar, which is a radiologist. It's a level of training. And this DAC bar said that, honestly, the information that you're going to get out of DMX versus flexion extension films are the same. Flexion extension films are definitely much cheaper, and anybody who has an x-ray unit can do those tests for you. So that answers that part of it. And hopefully that answers the pathophysiology side of that process, because when we start looking at the amount of movement, the snapping or the whipping, which is why they call it a whiplash, is the process of how somebody can develop this loose or torn ligament. So great questions. All right, the next part of this was, and which ligaments? All right. And then the follow-up to that was all cervical. No, it's not all cervical. Literally is any ligament within your body. Wrists, shoulders, your spine, your neck, your hips, your knees. It doesn't matter. Anytime that there is a change within that velocity, that can damage the ligament. Let's talk about football players with ACL tears, or soccer players with ACL tears. These are quick movements within their leg that strains that ligament to the point that it can tear it or damage it. So it doesn't matter. What we talk specifically in my practice, obviously, is chiropractic and the spine. But that's not what we're talking about here within the Posture Academy. I mean, we are, but it's not because of the chiropractic approach. It's a very different approach to this thing. So let's talk about the details. When we start talking about the actual cervical spine, we have to understand, all the segments within your spine, we have to understand that every joint has 9 specialized ligaments that hold it together. And unfortunately, 8 of those, and this includes the disc, 8 of those are on the back side of the bone. And there's only 1 on the front side. So when we tuck our chin down like this, you have 8 ligaments that are within the back of your spine and wrapping it around that help stabilize and protect that movement going forward. But going backwards, you only have 1. Which is why when we take our flexion extension films within my office and we look at the mechanism of injury, how was the crash happen? Was it a head-on collision? Meaning that the driver of the person, or the person that came in was a driver and hit a car with their car. They have 8 of those specialized ligaments that are going to protect the neck from snapping forward. We rarely see ligament instability within somebody who is the driver of a head-on collision. Rarely. And when we do see it, we know that it was significant. But almost with 100% assurity, based upon, obviously there's a lot of variables that go with this, but based upon the factors of being rear-ended, you only have 1 ligament. It's called the anterior longitudinal ligament. This anterior longitudinal ligament, or ALL, is the only ligament that really protects the movement going backwards, which is why if you've ever been rear-ended, rollover, T-boned, or any combination of those, the likelihood of you having a torn ligament within that front part of your spine is substantially higher than if you went forward. So hopefully that answers that question. And so we talk about which ligaments. It's really all of them that are attached to the spine that I'm talking about specifically, but it doesn't matter. It can be any ligament. Anybody who's had a labral tear or slap tear within their shoulder can attest that it doesn't matter. It could be a crash that caused that. It could be a fall that caused that. It could be a sporting impact. It doesn't matter. If you have ligament instability, then you have it because of the mechanism of the injury that actually created that. And so then we talk about the final part of this. Does this process occur with the remaining ligaments in the body? And the answer is, again, it depends. Yes, it does, but it also may not. If you can imagine, if you have an isolated, and we'll go to the car crash again because this is what I'm very specialized in. If you're wearing your seatbelt and you get rear-ended, or you get T-boned, or it's a head-on collision, any of these motions, it doesn't matter. If you're wearing your seatbelt and it goes across your shoulder and across your waist and it anchors you down and you get into a crash, your head is going to snap forward and your body is going to remain stabilized. If you're rear-ended, we have to understand that the impact of the car causes it to compress on the springs, and depending on the head restraint and the backrest of your seat, you ramp up that seat. And if you ramp up and the head restraint's too low, meaning that it comes down below because the car drops down on the springs because you ramped up, your head is going to snap over like this. And if your head snaps over like this, you do not have that protection on the front part of your spine, that ALL that I was talking about. But then in the process of you getting rear-ended, your body comes like this, and then once you get in contact with the seat, it's going to then propel you forward, which then again your seatbelt is going to restrain you, and then the head's going to snap forward like this. These are the most common mechanisms that happen. So I really hope that this answers whoever commented this. I hope it answers their question. And I hope that it also answers a lot of the questions that you may have in regards to what happens to the ligaments within your spine, why you have instability, why having something that was damaging to the effect of the forces that may have created this in the first place. I hope you understand that there is great importance of making sure that the ligaments that you have within your spine, no matter how they got damaged, there is a way that we can create stability. We talked about the chiropractic adjustments. We talked about how every time that we move those bones, it creates a little workout for those muscles to be able to create stability and strength. But that's not the only way. And that's actually really what the Posture Academy is all about. We are trying to improve the posture, and we're going to have more videos to talk about this one. The reason behind we want to improve the posture is because the position of your head creates a leverage that pulls down onto your spine back through here. There's a saying that where the head goes, the body follows. We also have to remember that the head weighs about 10 pounds. And if you really want to understand how that feels, grab a weight that's 10 pounds and lift it. And you can imagine that the weight of that equals your head. It doesn't really make sense that it's that hard to move the weight compared to how easy it is to move our head. We just have our muscles that are much stronger specifically for that. So when we talk about posture, and we start talking about forward head carriage, we start talking about the ligaments that stabilize the individual joints, and we talk about the muscles that help to support the ligaments, and when the ligaments are incapable of doing their job, the muscles have to take on the slack. It has to pick up the difference. Because if we don't, then you start getting into this thing called a postural slide, or like a postural avalanche, where everything just kind of slowly degrades. And there's some other research that's out there that supports this, and I'll do videos about this one as well. But the thing we have to understand, we have to remember, is that if we can't get our head back over the spine where it is creating balance and stability within our spine, then we are going to create extra strain on the ligaments. We have to correct the posture. If I wanted this to just be exclusive about improving the strength of the muscles, I would not have called the company the Posture Academy. The posture is such a vital part of this whole process. We have to create better posture so that we can take a lot of the pressure off of the ligaments, so that the work that we do within the strengthening of the muscles is a lot more effective in creating that stability. All right, with that being said, that's kind of the response that I have to this person's question. I hope it answers it. One thing I do want to provide, I have a free book, and it's called Finding Calm. And the purpose of this book is really to give understanding of what's going on within your spine, within your ligaments, when you have ligament instability. Maybe you don't even officially know that you have ligament instability and you just suspect it. This book will help give some guidance and some answers. It helps to give clarity. And I also created this so it gives you some hope that there is a process, there is a way that you can actually create greater stability within your life. And that's the whole point of it. And it's completely free. I will link it down in the descriptions below. But I really hope that you take advantage of this because we have an epidemic and it's greater than you can possibly ever imagine. There are more people that get ligament damage every single year than is ever reported. We have over 3 million cases of whiplash that happens every single year. And if we were to take even just a fraction of that number, you can only imagine the number of people who have now a permanent injury. Over 40% of the people who get whiplash have a permanent injury. 10% of those have complete disability. It completely destroys their life. I am seeing this within my practice. I've seen it for the last 23 years. There are people that have damaged ligaments that did nothing about it years ago, and all of a sudden here it is, 10 years later, 12 years later, they have problems, they have pain. There is no choice for them. They have no hope. At least they think that they have no hope. And it's such a blessing for me to be able to provide an option for them. This book is really for you to gain a better understanding. So anyway, I hope that makes sense. I'm excited to talk about some of these other things that are directly connected to the ligaments and to your health. But in the meantime, I want you to download that book. It's completely free. It's called Finding Calm. You'll see the link in the description below.